Okay, so good afternoon, everybody. As is tradition, I'll start with our public health hero of the week. I want to recognize the work of Travis Lander, the Emergency Preparedness and Workforce Development Coordinator for the Unified Government, Wyandotte County, Kansas City, Kansas Public Health Department. Travis has worked for months to break down the barriers Wyandotte County residents might face in navigating the vaccination process, ensuring that the entire community is included in the unified government's planning. He set up a process for providing wheelchairs for those who will have a difficult time standing in line for vaccines. He's ensured that non-English speaking residents were provided translators and translated materials. Notably, he spearheaded efforts early on to create a strategic COVID-19 vaccination site design that is both replicable and cost-effective. He actually sketched his idea for the vaccine site's workflow on a pizza box before eventually bringing it to life. And now he routine counsels neighboring county officials on best practices for design, process, and procedures for vaccination operations in the region. Okay, so Travis, if you're watching, I want to thank you for your creativity and your commitment. Your work is paying off in a big way for lots of folks. So now on to the numbers. Since Monday, Kansas has reported 3,262 new positive COVID-19 cases and 96 new deaths. This brings us to a total of 272,517 cases, 8,268 hospitalizations, and 3,718 deaths. On the testing front, I can announce that Kansas has officially exceeded 2 million total COVID tests administered, with over 1.1 million Kansans having been tested at least once. So I appreciate all of the state health officials and the local providers for their continued partnership on this effort. In addition to the 35 sites that are provided by our external partners, over 60 community testing partners have signed up to sponsor testing sites and provide greater access to testing. This kind of widespread testing is how we catch asymptomatic COVID-19 carriers and keep the virus from spreading in our communities. Vaccines. As most of you know, our biggest challenge continues to be the national shortage of vaccines available. I was encouraged yesterday by the announcement from the Biden administration that states will receive a 16% increase next week and an overall commitment to increase the supply of vaccines delivered going forward. The administration is also making a critical planning commitment to give states 3-week vaccine distribution forecasts. Since we began receiving vaccine shipments in December, we've been notified on our allocation details on a week-by-week basis, which basically created a weekly logistical fire drill. Having the additional time to plan will provide clarity and improve communication with local public health departments and providers. My administration and the Kansas Department of Health and Environment continue to prioritize transparency and communication with public health officials and Kansans alike. Yesterday, I announced that data regarding county-specific vaccine dose allocations are now available on our state's vaccine dashboard, which can be found at the website kansasvaccine.gov. KDHE considers multiple factors when allocating vaccine doses to counties, including population size by priority group, whether a provider is able to ensure the vaccine can be kept frozen if necessary, how many individuals a provider can vaccinate in a given time period, and the risk of illness and death in the community the provider serves, sometimes referred to as the Social Vulnerability Index. The goal of our communication to Kansans, to local public health departments, and to members of the press is aimed at demystifying the process of vaccine distribution. I know Kansans still have questions, and that's why we are continuing to build out our communications channel, like the county-specific allocation information announced earlier. We continue to update our dashboard with new information and to share that information with local public health departments, stakeholders, and the public. When it comes to other online resources, we're developing an interactive vaccine finder tool. When complete, the vaccine finder will allow Kansans to find the closest provider to their community, how to contact that provider, and other relevant information such as office hours, phone numbers, and whether online scheduling is available. I'll have more on that next week. Finally, vaccine allocations. Next week, our state is set to receive 17,550 prime doses from Pfizer and 23,500 prime doses from Moderna. I want to thank each and every one of you tuning in for your patience and understanding as we do everything within our power to speed up the vaccination process. And although we can see some light at the end of the tunnel, we have many months yet to bring this dreaded virus under control, and I thank you all for your continued vigilance. And with that, I'm going to hand it over to Dr. Lee Norman, Secretary of the Kansas Department of Health and Environment.
Good afternoon. While the federal government manages the delivery of vaccine supply to providers, state governments are responsible for determining the distribution, as the governor pointed out. This means states are responsible for allocating available doses for providers and submitting orders to the federal government. During phase 1, vaccines were distributed to hospitals using and we've talked about this in the past, the hub and spoke model, meaning that the vaccine went to one of 5 particular hubs, especially allocated regionally across the state, and then they went out from there to hospitals, local health departments, and federally qualified health centers. And part of the reason, keep in mind, was that was because it's ultra cold storage, and a lot of the areas around the state needing the vaccine didn't have the ability to do ultra cold storage. We have now entered phase 2, which includes vaccinating a broader population than just healthcare workers and long-term care facilities. The hub and spoke model, with so little vaccine coming into the state from the federal government, no longer made sense. We've always planned then to move to a different model after phase 1, which is what we're doing. Vaccines are now being shipped directly to local health departments, no longer using the hub and spoke model. Local health departments then determine how to vaccinate their communities within phase 2. The local control allows health departments to have flexibility regarding how they address their community's unique needs. This week, we will begin displaying county allocations, as the governor pointed out, on our kansasvaccine.gov dashboard. On a weekly basis, you will be able to log in and see the allocations for each county. We understand that and here are some frustrations across the state about the slow trickle of vaccines into Kansas. We share this frustration. We are in regular conversation with our federal delegation and the White House, Operation Warp Speed, about the need for more vaccine. I did want to take a moment and show you in this diagram form how it works, the distribution. So how does the vaccine come to Kansas? The process for getting from manufacturers to administration sites. And there's...
Would there be any way to move that forward so we all can see it? I mean, know how much of that you were going to use on there. Thank you so much.
Is that good?
A little bit more if you could. I just think it's very important for people if you bring that out here.
Can I look at it too, though?
Absolutely.
No, I know it by heart.
Thank you very much.
Yeah, you're welcome. So this is, of course, where the vaccine is manufactured. Currently, Pfizer and Moderna, hopefully in the not too distant future, Johnson & Johnson, and the AstraZeneca. Although AstraZeneca's had a few stumbling blocks along the way in going towards FDA submission. Then it goes to the distribution center, in this case McKesson, who makes sure it's all packaged and ready to be sent out, and then it comes to the administration sites. And we've talked before about phase 2 and beyond. The administration sites are going to be broader than just local health departments, safety net clinics, and hospitals. It'll be community pharmacies. We talked about public health clinics, doctors' offices, and mobile vaccination sites. The map that the governor referred to will show that. It has a map of Kansas, and it has lots of dots. Some of them are turned on, meaning that they're receiving vaccine, and the user will be able to get information about that. Some will be registered but not receiving vaccine, so it's like, don't bother for a while yet on that site. And then there'll be lots of gray dots, which are ones that are registered for us right now, but are not receiving sufficient vaccine to turn those sites on. It should be mildly reassuring, by the way, when you see the distribution. It's in multiple locations in every county. One thing that we've heard a lot about, Operation Warp Speed, and this word kitting, where kits are made, because it's not enough just to have the vaccine, the 975 doses per pizza box. I showed you that a few weeks back. But also the lots of 100 that come from Moderna. You have to have things like alcohol wipes and syringes and Band-Aids. And when you do 3 million or 6 million vaccines, that's not a trivial thing to do. So what these guys do then at the distribution center is they marry up the vaccine with the ancillary supplies and then come to the administration sites. And I did want to point out one thing that's very interesting, and that is something as mundane as a syringe. Remember we talked about some weeks ago that the 5-dose vials of Pfizer, we were able to get a 6th dose out of there. When the Operation Warp Speed and the vendors switched to a different syringe, it had more what we refer to as dead space, meaning they only got 5 doses out of a 5-dose vial. And we said, oh, let's go back to those old, because that really adds up. 1 out of every 5 doses added in. So we get more capacity with something as mundane as the detail that goes along with what type of syringe is it. And it's been quite helpful. They've been complied with that. So shifting from this for just a moment, genomic sequencing. So this is a science lesson, if you will. You heard me mention that we've had one correctional facility that had been without any cases for a while and then very quickly moved through this particular facility with quite a number of cases, which the fact that it acted differently is we have been watching for because of these variants that you've been hearing about of the SARS-CoV-2 samples, the B117 UK variant, the United Kingdom variant, the 1351 South African variant, or the P1 variant from Brazil and Tokyo. They ostensibly spread faster, and there's concern that they might be a bit more severe. So, although that's yet to be confirmed. We are, in response to that, wanting to know what's going on in Kansas. And so what we've done is increase the number and capacity of the genomic surveillance, where we map out all the gene sequences to see if it's different than the ones that have been circulating in Kansas. The process we use to identify a random subset of the positive samples for a day or a week that meet criteria to indicate that we can successfully sequence a virus of that sample. We've not seen any yet, and we haven't, from this particular correctional facility, we have not gotten that. We hope to get that result back tomorrow. We then assemble these samples and the genomes and analyze the variants and see if there are any of those variants of significance. This allows us to know generally what, and I would call it a family. We referred to it in the past as kind of Ancestry.com comes to genomic sequencing. You can find out what particular viruses relate to which viruses and where do they come from. We have found most of these samples fall in just a very few groups. And as we noted, they have not identified any of the variants so far. That's the end of my prepared comments. I'll turn it back to you, Governor, for questions.
Governor, kind of one of the things that's been related to the pandemic is unemployment surges and unemployment claims, and spoke with some Republicans today who've been looking at the initial claims numbers. They're very high for the last couple of weeks. They suspect that a large number of those initial claims are fraudulent. They worry about that, and they argue that your administration doesn't have a handle on how big the problem is, and that you're not giving them enough information that they can help you solve the problem. What's your response to all that?
You know, I think that they may be absolutely right. You know, there has been a surge in the number of claims recently. That very much could be related to the fraudulent claims that are being submitted. And to that end, we have a plan in place right now that on Saturday, this coming Saturday, we will be shutting down the system to be able to put in place the fixes that need to be there so that when we reopen the system Tuesday morning at 7 a.m., the fixes will be in place. And the fix really is going to be an enhanced verification process so that, because we think that's why so many are getting through, is that, you know, right now you just sort of need sort of name, rank, and serial number, social security number in this case. We'll make sure that everybody who is filing for claims or has filed for claims is putting in additional verification stuff. You know how they ask you the middle name of your grandfather, you know, or you know what was your first car. There will be those kinds of personalized questions that would be very difficult to steal off of Experian or something else like that. So that system is going in and will be open Tuesday morning, and we expect that the number of fraudulent claims will plummet because we have that protection in there. You know, a number of other states have already done this. You know, we're not able to get to it as quickly because we've got this 45-year-old antiquated system that really required a lot of preparation in order to be able to move over here. We've been working with Accenture on this, and they've come up with a solution to the problem, and that's what we will implement this weekend.
Governor, do you expect benefits to be delayed more so because of this shutdown? And then do you have any update on a permanent secretary that you'd like to name for labor?
On your first question, do we expect any delays? Yes, we do. You know, we're going to today and tomorrow take all of the claims from this week that are in there and try to get them out. But then we will not be paying out claims for PUA, the federal, or for our usual unemployment until we reopen on Tuesday. At which point, though, we will ensure that everybody gets their just due, retroactive what we need to. And on the other question, stay tuned. We do have an announcement coming soon.
A testing question. You know, Dr. Nolan said that the free testing program was scheduled to end January 31st, which is really soon, which is, you know, this coming Sunday. So then what can Kansas expect, you know, when Sunday comes? Will the free testing program just end? Will the new money from Congress, you know, be continued? Is it extended? I'm just wondering what the
I'm sorry, what do you...
Oh,
I couldn't understand the very first.
Dr. Norman said earlier this week to a committee meeting that the free testing program was kind of scheduled to end January 31st, which is you know, this coming Sunday, which is pretty soon. So I'm wondering, you know, what can Kansas expect to happen when Sunday comes? You know, does it end just there, or is it going to be extended with new money from Congress, etc.? Yeah,
no, I think our intention is to sort of approach it from multi-pronged going forward. You know, yes, we do have new money coming in from the feds. You know, some of that started to come. More will come as we go, and a lot of it is designated for testing. So we will use that to continue to ensure that anybody who wants to get tested can get tested. But we will also, we're looking at the component, we're trying to work out all of the details, because whenever you deal with insurance, it's complex, but we're trying to work that out so that if someone has insurance that would cover the testing, we'll be able to bill for that.
Governor, a question for Secretary Norman, but can you kind of break down how each county gets, you know, there's a certain amount of allocation for a vaccine? So I know for us down in Sedgwick County, we're the biggest county, largest city here in Kansas. How do we get, you know, the vaccine numbers compared to somewhere out west or somewhere? How does that break down happen?
Well, I will let Dr. Norman, you know, give you the details on what gets put into that algorithm that's used to determine that. But I can tell you that the biggest problem for all of our counties is the number of vaccines that we get into the state. You know, we're just not getting the number that we need. No state is. You know, the vaccine shortage is nationwide. It's worldwide. So, you know, we're very happy that, you know, we're going to be getting more, and that we know how many we're going to be getting 3 weeks out now. But even with that increase that's being offered, that's not going to be enough to meet the demand. But let me give the microphone back over to Dr. Norman to give you more details on.
Thank you, Governor. Yeah, good question. The biggest driver of it is population size, and actually Sedgwick County is the second largest county in the state after Johnson County. It's not a huge amount of difference, but there's 7 of the primarily larger and urban counties that get a disproportionate share, but every county gets vaccine every week. But some of the ones will get 7,000 doses and some will get 100. You know, some counties have 1,700 people and some have 260,000. So not surprisingly, the per capita is one of the biggest drivers of that. And that'll be transparently displayed, and so you'll be able to look at that.
Mr. Secretary, you said that the virus in the outbreak was the fact that it acted differently that clued you to the possibility of it being a variant. How did it act differently? Yeah, it was the rapidity of the spread. To go from 0 to, and I'm not going to say the number of cases because I don't know it on the top of my head, from 0 to quite a number of cases over just a very short period of time, a day or two, is just a faster spread. So it's just an index of suspicion, John. It's not an absolute sure thing that that's what it is, but it acted so quickly and this correctional facility is doing things right. It's not like that they were doing things wrong. It just acted enough differently, and we have the tools, so why not be safe and really understand the enemy that we're dealing with.
Last question?
I got a question about Stone Vale and other hospitals having long lines to have these people get these vaccines. Is that a supply issue? Is that an organization from the hospital? Is that the week-to-week knowing of how much you're going to get? What is that? And how do people fix that?
Yeah. I don't know, Governor, if you want to add anything in, but I do. Every place is different. It's driven by a number of things. One is a vaccine clinic isn't easy to put together on short notice. It takes a lot of personnel, and especially with masking and distancing and the like, you have to spread out to keep it a safe environment. The short timeline, and the governor referred to this, to have maybe one day of notice. Are we going to get 100 doses? Are we going to get 300 doses? It's just nightmarish then, because then you have already gotten, and you would hate to have 300 people scheduled and only have 100 doses show up. So this 3-week timeline, advance notice, may sound trivial, but it's not at all trivial. Mostly, a lot of counties have new scheduling systems, because while essentially all the health departments have long histories of vaccinating, this crush of demand for a small amount of vaccine product is new in the annals of public health. So that's, we're learning as we go. And I know Joko yesterday had a problem, and I know that they've already gone back and done kind of an analysis and are tweaking it, but it'll take a while to walk before we can run.
We actually did talk to the folks over in Johnson County, because I saw that picture too, with just a long line of people over 65 waiting, and they did have appointments, but everybody was a lot of folks were very anxious, and they got there early, and they sort of created that line. But we need to anticipate those kinds of things and accommodate for them.
Thank you.